Hello, my name is Daniel Stillwell, and I'm the editor of the IFTA e-newsletter. And we have with us today Dr. Afarin Rajaei. She is the associate editor for the International Journal of Systemic Therapy and an assistant professor at Alliant International University. She's going to talk about her new role at the journal and a little bit about the work that she does. So, Afarin, good to meet you and glad to have you here.
Hi, thank you. Thank you for having me here. I'm so excited to have this conversation with you, Daniel.
Wonderful. The first question that I like to ask all of our people is we see people all over the world. We have professionals in every country. What is your background professionally? What kind of mental health practitioner do you identify with? And what does that look like where you work?
Sure, it's a great question. So I'm a licensed marriage and family therapist. I studied marriage and family therapy, and then after that, I studied medical family therapy for my PhD. So I guess I identify as a systemic therapist, and also my approach is holistic. So I studied medical family therapist, and even though right now I'm not working at an integrated healthcare system per se, but in my traditional kind of like therapy clinical work that I do with clients. I try to have that biopsychosocial spiritual framework and practice that holistic perspective and asking them about different questions about their, biological aspects, psychological aspects, social world, and also a spiritual world when I work with them.
Very nice. When you work with your clients, what are things that you find most enjoyable or meaningful to work with?
Oh, everything. So, funny story. So, I decided to become a therapist when I was 14 years old. So, in that age, I just knew that I didn't find happy relationship around myself, including my own parents. But I saw happy relationships in movies, mostly
Mm,
Hollywood, right?
right, right.
So I was like, okay, if there is happy relationship, if that exists, but I don't see it, there should be a way to work on it. And all I knew about mental health world in that time was like psychology. So I told myself that I'm going to get a PhD in psychology and I'm going to become a psychologist and work with people on that. So all that being said, like I found relationships and stories and all those different things interesting since the very beginning. And this is the same thing today that when I work with clients, like understanding their perspective, their life stories, all the different things that they've been through, positive, negative, challenging, interesting, all those different things, it's interesting for me. And also it's very powerful and beautiful to be privileged enough to be on this position, to work with clients and see the glory in change and
Mm.
empowering people.
Wonderful, wonderful. Well, so let's get to your professional work. Tell us a little bit about research or things that you get inspired by, and then a little bit about how you've transitioned that into being one of the editors at the journal.
Sure. So right now I'm active in all of the clinical world, the teaching world, and also research world. So I'm assistant professor. So I work with students and I try to train them to become a good therapist. I also do some studies, and in my research, I'm mostly interested in exploring romantic relationships from different aspects, including biopsychosocial, spiritual framework. And I'm also interested in diversity inclusion work. So my recent publication is about actually diversity and inclusion work. Is it deep? Is it just shallow? Is it performance? Or is it
Mhm.
like something that we really care about? And in my clinical work, as I mentioned, I have a small private practice and I work with individuals, families, and also couples, but mostly couples and couples with chronic illness or cancer. And then this position, this opportunity, came to my door, and I was very excited about it because, as I mentioned, I'm interested in the research world, and also this position not only is about working on manuscript, like reviewing them, but also is about kind of like promoting the journal in different social media platforms, including YouTube and Instagram. I have an Instagram page myself with many followers. So I try to advocate for mental health in my personal page. And it's also interesting to get a chance to promote research and systemic perspective in mental health world, via those platforms, Instagram and YouTube channel. So in our YouTube channel, actually, I do something similar to what you're doing, Daniel. I interview with different people, sometimes experts in our fields, and I talk about their expertise or something that's interesting for them or their recent publication, something like that. And I hope that people find it interesting and helpful.
Wonderful, wonderful. So it sounds like you are not only getting to bring some energy, but being able to diversify the reach of the journal beyond the editor board landscape so far.
Yes, yeah.
Wonderful, wonderful. All right. Well, then I hope that we get to know you a little bit better in this new role and just in the field. I assume will you be at the next conference in Japan?
Yes, I'll be there.
Fantastic. All
Are
right.
you going to
So
be there?
yes, I will. Um,
Okay, awesome.
so members that may recognize you from this or something else can hopefully say hi and
I'll be
celebrate
happy.
the role that you're going to have at the journal. Anything else, either about you personally or professionally, you think would be interesting or fun or just awkward or whatever to share for the viewers?
So I guess professionally, I'm just right now I'm excited about kind of like the interaction between all these different worlds, because sometimes when we study in any sort of mental health field, we sometimes just get trained to become a therapist, right? So
Right.
that's our only mindset. And I'm excited about all these different things that I do as a teacher, as a researcher, as a therapist, and also, combining all those different things when I produce or create some content for social media. So that's something interesting for me professionally. Personally, one of the recent things that I'm doing is I'm trying to integrate art into my life. I listen to all these different podcasts and read research about how art and having art in your life is helpful, and it helps with creativity, blah blah blah. And I'm a very huge fan of TV series, movies, cinema in general. So right now I started digging deeper in those things, and having more art in my life, spending more time with art. So we'll see how it goes.
Wonderful. Yes, we know that it has a strong angle for meaning making therapeutically, but I'm glad that you're in some ways drinking our own Kool-Aid and using it to improve your own life. So that's fantastic.
Thank you. Appreciate it.
All right. Well, thank you for joining us, Dr. Afarin Rajaei, and we'll hopefully see you in Japan or just around. And those of you who are confused or don't remember, if you are a member of IFTA, you have access to the International Systemic Therapy Journal. So we are hoping that you will read it, find it, engage it in any way you can. So thank
Yeah.
you.
Thank you. Thank you for having me.